Greater Dandenong has an incredibly diverse community. It's a rich tapestry of all sorts of cultures, religions and faiths, and because there is such diversity of community here, those understandings of suicide are quite different. For many communities, there perhaps is not even a term for suicide within their language. I'm Alison Asche and I work for the southeastern Melbourne Primary Health Network, and I lead the suicide prevention place-based trial in the Greater Dandenong area. The place-based trials are 4-year initiatives between the Commonwealth Government and the state government, and the aim is to take a community engagement approach to actually addressing suicide and reducing suicide at a place-based level. So that's working with the nuances of the particular area.
For the last few years, we've been dealing with a lot of suicide, especially with young people, and it affects us a lot. You know, it's not part of our culture.
These young people are Australian, but their families see them as African, and that they should have the culture, you know, the expectation.
So today's co-design session was one of many that we've been doing towards developing a culturally specific training for the South Sudanese community.
This community-based approach will definitely work because it gives ownership to the community to develop a very good product.
We're developing training programs that are going to help not only the South Sudanese community, but also other culturally and linguistically diverse communities to more effectively understand what mental health and suicide looks like, and to put preventative measures in place to help work with those who are at risk. Having lost my brother Nathan to suicide, I bring a desire to truly help those who are in need to find their voices and to use the insights and the knowledge and the wisdom from their own experience to help others who are around them.
In addition to the work with culturally diverse communities, we have been doing some extensive work with in upskilling GPs, general practitioners, and also allied health workers such as psychologists. The other area that has been a significant piece of work has been in developing what we call a postvention protocol. The idea there is to be able to have a coordinated approach to reaching out to individuals who have lost a loved one to suicide, and to provide support in a much more dedicated way for those individuals.
A spotlight on suicide prevention is really important, galvanising the community around a really important issue, and certainly it's brought together lots of stakeholders in the local area around kind of working together on suicide prevention.
Pastors, we are the first responders. When things happen, we journey with family, we bury their dead and the loved ones, and then we move to another family. So it is very important to have these kind of workshops to give us the tools.
I'm extremely passionate about suicide prevention. I've been in the area now for about 25 to 30 years, and if there is a chance that we can make a small difference in even just one person's life, then that's my reason for being involved.